In today's educational landscape, one issue rises with increasing urgency: the mental health of our students. This video is for educational and informative purposes, based on public data and reliable sources. The opinions of the AI School channel expressed in this video reflect an analysis of the subject and do not replace medical or psychological guidance. Terms like youth anxiety in schools, student depression statistics in the U.S., and school mental health programs are no longer rare in search engines. Parents, teachers, and young people themselves are turning to Google and YouTube, seeking answers to an invisible epidemic that is taking hold in classrooms across America. This comprehensive narrative aims to explore the scope of this crisis, its roots, its consequences, and, above all, how we can and must respond. We will also consider comparative insights from Mexico and Brazil to add context to the North American reality. Introduction. The silent epidemic in our classrooms' mental health has become one of the defining educational challenges of our time. In the United States, a growing number of students struggle with anxiety, depression, trauma, and emotional dysregulation. While schools are places of learning, they have also become frontline arenas where these emotional battles are fought silently every day. According to the CDC, more than 40% of high school students in the U.S. have reported feeling persistently sad or hopeless, and suicide remains the second leading cause of death among adolescents. This isn't just a public health issue. It's a cultural wake-up call. How did we get here, and what can we do to change course? Chapter 1. Understanding the crisis. Numbers that speak volumes. Recent studies in the U.S. reveal staggering data. The National Institute of Mental Health estimates that nearly 1 in 5 U.S. adolescents has a diagnosable mental health disorder. Emergency room visits for suspected suicide attempts among teen girls rose by more than 50% during the pandemic. Even as schools reopened, the emotional toll did not subside. Stress, social disconnection, academic pressure, and home instability have amplified the crisis. Mexico shows similar trends, with an estimated 3 in 10 adolescents reporting anxiety symptoms. In Brazil, a 2022 survey by the Ministry of Health indicated that 15% of students between 13 and 17 years old had experienced depressive episodes. These figures reflect more than isolated cases. They expose a systemic issue requiring systemic solutions. Chapter 2. Root causes. The perfect storm. The youth mental health crisis is not rooted in a single factor, but a web of interconnected influences. Academic pressure. The drive for performance and standardized testing creates chronic stress. Social media. A constant stream of curated realities fosters comparison, inadequacy, and cyberbullying. Family dynamics. Divorce, abuse, neglect, or economic hardship contribute significantly to emotional instability. Socioeconomic inequality. Low-income communities often lack access to mental health care and safe environments. Post-pandemic trauma. The COVID-19 pandemic disrupted routines, isolated students, and introduced widespread grief and anxiety. This storm has hit vulnerable students hardest, especially those from marginalized communities. It has become clear that mental health is not a luxury issue, it's foundational. Chapter 3. The role of schools as first responders in the absence of sufficient mental health infrastructure. Schools have become de facto mental health hubs. Teachers are often the first to notice behavioral shifts, emotional withdrawal, or academic decline, but most schools are underprepared. In the U.S., the student-to-counselor ratio is approximately 408 to 1, far exceeding the recommended 250 to 1. In rural areas, the situation is even more dire. Many counselors lack the training or time to address complex emotional needs. However, promising models are emerging. Some school districts are integrating social-emotional learning curricula, peer support groups, and mindfulness programs. Schools in New York City, Los Angeles, and Seattle have piloted trauma-informed education and mental health training for staff. Chapter 4. Families and communities, delays or obstacles. Parents and caregivers play a critical role in youth mental health. But cultural stigmas, generational gaps, and lack of information can lead to denial or delayed support. In immigrant communities, including large populations in the U.S. and Mexico, Mental health issues may be minimized or misunderstood. Some families view therapy as unnecessary or shameful. Conversely, when families engage proactively by recognizing signs, validating emotions, and seeking help, outcomes improve significantly. Community health centers, churches, and youth organizations can also bridge gaps by offering culturally competent services. In Brazil, a growing network of CAPs has brought support closer to schools, although gaps remain in rural areas. Chapter 5. Digital pressures and the double-edged sword of technology. Perhaps no factor is as uniquely modern and omnipresent as digital life. While technology has democratized access to knowledge and socialization, it has also created new stressors. Screen addiction. Excessive screen time impacts sleep, focus, and emotional regulation. Online harassment, cyberbullying, and social exclusion leave deep psychological scars. Constant comparison. Exposure to filtered lives erodes self-esteem. Yet technology can also be part of the solution. Apps for meditation, therapy chatbots, and anonymous helplines have emerged. Platforms like YouTube, when used thoughtfully, can spread awareness, normalize emotional struggles, and provide practical coping tools. What matters is how we teach young people to use these tools. Digital literacy must include emotional literacy. Chapter 6. Building a school culture that heals. Healing-centered engagement goes beyond individual counseling. It requires a school-wide shift in mindset, training for all staff, not just counselors, but teachers, bus drivers, cafeteria workers, and principals must recognize signs of distress. Peer-to-peer support, programs where students support students reduce stigma and build empathy. Restorative practices, shifting from punishment to dialogue helps address root causes of behavior. Safe spaces, creating physical and emotional zones where students can decompress, breathe, and be heard. Some U.S. schools have invested in wellness rooms, calming spaces with sensory tools and staff trained in de-escalation. Others have redefined discipline policies to consider trauma backgrounds. In Mexico and Brazil, pilot programs in urban centers show promise, but scaling them remains a challenge. Chapter 7. Policy and investment. What governments must do. Systemic change requires policy support. In 2021, the U.S. Surgeon General issued a national advisory on youth mental health, calling for expanded services, early intervention, and equity. Key priorities include funding for school counselors, increasing hiring and salaries to attract qualified professionals, universal screening, catching issues early without waiting for crisis, integration with primary care, schools partnering with local clinics to provide continuous care, legislation on digital safety, holding platforms accountable for harmful content and promoting safer online environments. In Mexico, the Secretariat of Public Education is piloting mental health modules in secondary schools. Brazil has passed legislation to introduce mental health education, but implementation is slow. Governments must treat youth mental health as a non-negotiable investment, as essential as textbooks or vaccines. Conclusion. Toward a culture of care, the mental health crisis in schools is not a passing trend. It is a generational reckoning. It challenges us to rethink what it means to educate, to nurture, and to prepare young people for life. No student should suffer in silence. No teacher should feel alone in addressing emotional distress. And no parent should be left without tools or support. America, with its innovation and resources, can lead this transformation, but it must choose to. That means listening to students, funding real solutions, training every adult in a school building, and normalizing the simple truth that mental health is health. If we can create schools where minds are valued, hearts are heard, and help is never far away, we won't just be improving grades or reducing absences. We will be saving lives. Because when students feel safe to be whole, they can finally learn what they were always meant to, how to thrive. Thank you very much for watching. Please don't forget to subscribe and turn on notifications. See you next time.